questions.
Thank you very much. I'm Dr. Colonel Randhir Puri, Medical Superintendent, Sahara Hospital. What we have heard just now is the perspective from the public sector units. If the private sector units, what is happening is that not only we are trying to do the same what is being suggested for the last 7 to 8 years, our hospital information system is totally integrated, patient-centric, and as well as it provides all solutions for the clinical activities for the patients. The aim here is that what we want to do is to give the patient safety and the care at the topmost thing. So that is what we are able to do it, that at the patient's end only, the doctor is able to see investigation reports. All the radiological reports are there, whatever decisions are taking, OT bookings, all the information, whatever is being suggested is already existing at the Sahara Hospital. In addition, I think I'll like to put across here that Sahara Hospital, probably you all can confirm it to me, that is the only institution in presently as far as the Lucknow is concerned which has a pneumatic tube system. All India Institute has it, isn't it? All India Institute has the pneumatic tube system.
Yeah, no, we do have.
You do have.
We do have.
Acha, SGPGI.
Yeah, we do have PTS with us.
Okay.
AIMS doesn't have. Till I was there in year 2012, which was not.
All right. This is the system by which we transport patient sample anywhere from any station to the lab, as well as the drugs, if they need to be transported in a small amount from the central pharmacy to the patient station. That's an innovation, that's a technological innovation which can be utilized in the public sector, though it's a cost-intensive thing and needs a lot of money for the maintenance. But this is one thing which can add to the, it reduces the workforce, as well as the errors, as well as somebody getting it lost on the way. All that can also be utilized for it. And the other solution is that, you see, what we have to realize now is that all the applications, all the workings now is going to be handheld devices. Come another 5 years, you will have approximately 50 billion medical devices being connected to each other all over the world. If you will have that connection, and if you have the internet available, the technology is advancing, the people will utilize this facility, they will get more used to it, and they will probably provide the better solutions in the clinical settings. That's all I can say about it, and I wish for the future to be IT innovative, IT related, and IT integrated. Thank you.
Thanks, Dr. Puri. Now I request Dr. Mayank Somani to share his experience. He's from Medic Super Speciality Hospital, Lucknow.
Good evening, audience and distinguished colleagues. I represent Medic's Super Speciality Hospital, a 300 beds multi-speciality tertiary care hospital coming up in Lucknow. It's 6 months away from commissioning. And all talk about smart hospital, smart city. I'll be very smart here. I know the audience is really not interested in the volume overload of healthcare IT here. Now, what are we going to do with healthcare IT, or what smartly are we going to do in our hospital? Will again be a lot of data overload, where we are completely Wi-Fi, we're completely IT infrastructure, a large backbone of IT. But what I'll smartly tell you is what all of you might be interested in, is that if I walk in without any records, will my records be in position with your hospital? The answer is yes. See, this is a very common thing. When we go to a doctor, he says, did you bring your old records? And most people say, no, I forgot. I didn't bring my X-ray, I didn't bring my CT scan, I didn't bring back my blood reports. And this is very, very common. All of you would agree. And that is where our hospital, our infrastructure, our IT will give it back, that we have all your records, you don't need to bring it back. The other thing which we are introducing is eHealth, the mobile health. Suppose you do your blood sugars at home, and then you forget, you don't bring that chart. But that will be connected to our system. And you can actually, on a daily basis, upload it. And that for that matter, it's your ECG, which can be done at home, which can be uploaded then and there, or the blood pressure, or anything. And this is what you're interested in. So this is what Medics as a hospital is bringing into the city, in your own city here. I don't know how many of you know, but it is there on the Kanpur Road. The hospital is coming up. It's 6 months away from commissioning. It's near the Phoenix Mall. So this is what we're doing. There's a lot of stuff which is going to happen. with respect to IT infrastructure, the way smart hospitals are going to be. But as of now, I'll restrict myself here. People here are worried about the time factor as well. So thank you all of you for listening.
Thanks, Dr. Somani.